Today's topic is ESD training in Korea. Treatment of gastric cancer is rapidly changing. In recent years, 1/3 of gastric cancers are treated by endoscopy and 2/3 of gastric cancers are treated surgically. So, gastric cancer has become a prototype of multidisciplinary disease. I think endoscopists should learn the ESD techniques in their early training course, which is a very rare situation. The ESD training must be stepwise. Endogel ESD training is the ideal model for the ESD beginners. There are some basic knowledges before you start the ESD procedures. That includes advanced gastric endoscopy, including chrome endoscopy and magnifying endoscopy, indications, knives and snares, ESD techniques, and pathology interpretation skills. There are two types of indications. Absolute indication means differentiated type mucosal cancer without ulcer and not bigger than 2 cm. Expanded indications include differentiated type EGCs bigger than 2 cm and selected cases of undifferentiated type EGCs. This is the comparison of recent ESD indications in Korea and Japan. Korean indications are either strongly recommended or weakly recommended. Two of weakly recommended indications belong to Japanese absolute indications, so still there are some minor differences between the two countries. There are so many different types of ESD knives in the market. We need to know advantages and disadvantages of each instrument. The original product was the IT knife by Dr. Hosogawa and the flex knife by Dr. Yahagi. For a bowl-type knife, my favorite is IT2 knives. For a needle-type knife, I use all products from different vendors such as Dual Knife from Olympus, M Knife from Pentax, F Knife from Fujifilm, I Knife from Fine Medics. Many knives and snares are developed locally in Korea. Some of them have multifunctional characteristics and waterjet functions. This case shows how I use the H-type ESD knife. At first, I start with I-type tip for marking and circumferential cutting, and then I change into O-type knife for fast submucosal dissection. I think it can make the procedure quite short. The hospital stay for gastric ESD is usually 4 days. ESD training should be stepwise, and it should be always done with a teacher. Self-training is not a good way to learn complicated procedures like ESD and POEM. When I learned the ESD techniques from Japanese doctors almost 20 years ago, I made a memo about the technical details, which is still available at my homepage EndoTODAY.com. You can learn a lot of technical details at KSGE webinars in the Tuesday evening every other week. From now on, I'd like to talk more about the ESD training. Stepwise ESD training at my institution starts with basic training with an ESD training bag and doll. Next step is endogel ESD, ex vivo pig stomach ESD, live pig ESD, and finally the real case ESD. Movement of ESD knife is mostly circular and horizontal. For the training of knife control in the circular and horizontal direction, I developed an ESD training bag and doll. This is the ESD training doll. You can see the target in the back of the ESD training doll. You can learn how to control the ESD knife. Both the horizontal movement exercise and the circular movement exercise can be done with this training doll. This is the artificial layer endogel. It is originally released in a paper box, but the paper box setting is unstable and unnatural to do the ESD procedures. So, I developed an endogel ESD training module with the Kogen gastroscopy simulator. I recently made 2 docking stations or a platform for endogel ESD in the Kogen simulator setting, one with Pentax and one with Olympus. This is my recent endogel ESD training unit with Pentax Imagina system and its training manual. For the endogel ESD, I use an electrosurgical unit from the Airbac company, model 300D. My electrosurgical unit setting is monopolar endocut Q with coagulation effect 3, duration 3, interval 3. For the real patient ESD, I use endocut I rather than endocut Q. For the endogel ESD training, we are using 2 kinds of endoscopic knives. Pin knife is for the fiber by fiber cutting, and ball knife is for the plane cutting. We usually teach 2 kinds of procedures. Procedure number 1 is mostly a pin knife method. Procedure number 2 is mostly a ball knife method. The pin knife usually has a 2 mm tip. It is useful for detailed procedure such as gastric ESD at difficult location, colonic ESD, esophageal ESD, and the POEM procedures. I will show you the endogel ESD procedure using a pin knife named M knife from the Pentax company. For the circumferential cutting with a pin knife, I usually do the left side clockwise cutting first, right side counterclockwise cutting second, and finally do the horizontal cutting of the proximal part. In the next video, I will use the Pentax Splash M knife. The Splash M knife is a new multifunctional ESD knife from Pentax company. It has a needle-type tip with hooking mechanism. At the distal end of the knife, there is a metal plate which is useful for bleeding control even in retracted position. In my recent experience with the Splash M knife, I found 3 advantages. First, the hooking mechanism is very useful for the submucosal dissection step. When a lesion is located at difficult location and the approach is not easy, I usually used the dual knife and IT2 knife for a patient. But with the Splash M knife, I can do the procedure without using the IT2 knife. Second, the metal plate at the distal end of the Splash M knife provide enough contact area for the bleeding control during the ESD procedure. Finally, the procedure time is much saved due to the water jet function. Now, I'd like to start the EndoGel ESD hands-on training. I put the EndoGel plate on the Kogan gastroscopy simulator using a docking station. The red circle is the target of today's training. In the EndoGel ESD hands-on training, we will pass the marking and the submucosal injection steps. The first step is the circumferential cutting, and the mucosal puncture will be done at the 7 o'clock direction. The cutting is done continuously in the clockwise direction. The second cutting is done from the 5 o'clock to the 12 o'clock in the counterclockwise direction. Press the M knife slightly and keep going on the mucosa. It's something like a surfing. Control the knob and gently rotate your body to make a counterclockwise movement. To make a horizontal cutting, lifting the control part is helpful. We call it push-up. In this position, you can use right and left knob to make a horizontal movement. In order to do the submucosal cutting, exposing the submucosal layer is very important. To do this, we use a traction method using a clip and weight. Now you can clearly see the exposed submucosal layer. Submucosal cutting is usually from the right to left direction. You should control the catheter carefully to make a best cutting depth. Cut the submucosal layer fiber by fiber using the control and cut technique. In the submucosal dissection step, the approach angle is very important. The ESD knife should be close to the mucosa. In order to simulate this low approach angle, we are using a few wood blocks like this. Now the approach angle became lower. The final cutting line should follow the mucosal surface to avoid the submucosal tunneling.
지금부터는 mucosal 커팅 라인을 따라서 서핑하듯이 커팅을 시행해 보겠습니다. 네,
That's it. ESD simulation is done. I recommend to do the endogel ESD training 10 times before you try the live pig ESD or a real patient ESD. Ball knife has an insulated tip at the distal end. The ESD knife is usually longer than pin knife. In some models, there is a triangle-shaped knife below the insulated tip. I will show you the endogel ESD procedure using a ball-type knife named IT2 from the Olympus company. Don't be surprised, it will be a high-speed video clip. In a ball-type knife ESD, initial puncture should be made at 12 o'clock direction with a pin knife. Circumferential cutting can be done with a ball knife. This is a high-speed demonstration of endogel ESD. Initially, I made a small hole with a dual knife. Circumferential cutting was done with the IT2 knife. Using a clip, a traction was applied. I cut the lower 1/3 of the submucosal layer, very close to the muscle layer. This is the final cut. That's it. This is the first endogel ESD of a second-year GI fellow. It will take about 20 minutes. Recently, many local hospitals run their own ESD training session. This is a recent endogel ESD hands-on training at 대전 을지 Hospital. Some foreign doctors visit Samsung Medical Center for endogel ESD training. The next step is the ex vivo pig stomach ESD. Classically, we have used the simple silicone box. For the realistic training, we recently used a metallic box and connected it to the Kogan gastroscopy simulator. Due to the safety concerns, the ex vivo pig stomach ESD should be done at the animal surgery lab. Step 4 is the live pig ESD. We are doing the live pig ESD session at K-Tech Endoscopy Training Center at Songdo near the International Airport. The operator is a stomach surgeon experiencing the ESD procedure, and the assistant is a foreign endoscopist from Mongolia. The final step is, of course, a real patient ESD. Real patient ESD is actually a give and take method. There are trainer steps and trainee steps. I start with a careful examination of the lesion and make some markings around the lesion. And the trainee do the circumferential cutting. I do the submucosal injection, more cutting by the trainee, and give and take until the end of the procedure. When a young doctor finished his or her first ESD, I regularly have a one-to-one personal coaching session. In reviewing the endoscopy images, we usually have a long discussion about a lot of technical and oncological issues. Email consultation is always available. Please send me an email when you have any questions about any issues regarding the ESD for EGC. The next topic is the training opportunities. Where can I get the Endogel ESD trainings? Korean Society of Gastrointestinal Endoscopy, KSGE, organized a lot of diagnostic and therapeutic endoscopic workshops. Recently, the society organized a nice workshop with focus on the gastric and colonic ESD. It includes Endogel ESD, ex vivo pig stomach ESD, live pig ESD, and live pig colonic ESD. This is the program. KSG sometimes prepare Endogel ESD training sessions in their regular yearly conferences. Endogel ESD hands-on training can be done at any place, even at the conference booth. This is a live demonstration at the Pentax booth during the Korean Digestive Disease Week, KDDW, in 2019. The procedure was a pin knife ESD using the Pentax Splash M knife. As you can see, I'm doing the submucosal dissection step in front of a lot of people. There are some Endogel ESD training sessions in various medical meetings. This is the third Therapeutic GI Endoscopy and ESD Training TED conference in Daegu a few years ago. Many individual hospitals also have their regular or occasional Endogel ESD hands-on sessions. This is a recent Endogel training for Saudi Arabian fellows at my hospital. Some Endogel ESD training sessions are organized by endoscopy instrument companies. This is an Olympus Endogel ESD training workshops. This is a Pentax Endogel ESD training workshops at Joseon University Hospital, Gwangju. These are Fujifilm Endogel ESD training workshops. For the foreign doctors, 1 week ESD training course is also available at Samsung Medical Center. It consists of introductory lectures, ESD observation, ESD conferences, ESD planning sessions, hands-on training using Endogel or live pig. If you want to participate in this program, you can contact the SMC International Training Office. Tele-mentoring using iPhone FaceTime app is a very useful tool for ESD beginners. International mentoring is also possible. If you want some real-time comments from me, please send me an email at stomachly@gmail.com. Individual tracing of the personal ESD records are very important to improve ESD skills. In the next video, Professor Gong Sung-min will talk about his learning experiences at Samsung Medical Center and his initial career at Changwon Samsung Hospital. This is my first ESD with Professor Lee at Samsung Medical Center. At Changwon Samsung Hospital, it is difficult to start my own ESD procedures. Online video by Professor Na Soo-young was very helpful. He recommended that the ESD beginners should avoid a lesion at the proximal stomach. But my first ESD case was high body posterior wall early gastric cancer. The procedure was really difficult, and I get some help from one of my senior doctors. The final pathology was a poorly differentiated adenocarcinoma, so I recommended the additional surgery for her. After the first case, I experienced more than 100 cases for the 18-month period. The complication rate was like this. This is the procedure time. After 1 year, the mean procedure time became less than 30 minutes. This is the procedure time by the location. As expected, the proximal location is the most difficult area. Our pathologist always make a drawing like this, and it really helps me improve my procedures. Thank you very much. I still have many difficult areas, such as the unclear resection margin, undifferentiated histology, depth of invasion, submucosal fibrosis, and the colonic ESD. Thank you very much for your attention. Dr. Kim has a lot of experience in diagnostic endoscopy and simple polypectomy, but he has never performed real patient ESD. He has experienced only 3 times of endogel ESD. The tip of ESD knife is not seen. Why don't you push the ESD knife a little bit? We are using the Elbe electrosurgical unit with EndoCOT Q, effect 3, duration 3, interval 3. In this setting, the interval between each cut is 0.72 seconds. The endoscope moves a little bit jerky in the Kogan simulator, so the real patient ESD can be easier. Now we are approaching 11 o'clock direction. Stop here. Okay, the left side circumferential cutting was excellent. The next step is counterclockwise cutting from 5 to 12 o'clock. Now he's doing the edge cutting. You need to cut the middle or the lower 1/3 of the submucosal layer. If the submucosal cutting is upper third, it may cause a lot of bleeding due to high blood vessel density. So try to cut the submucosal layer as deeply as possible. Dr. Kim said that the movement of the endoscope and the ESD knife during the endogel ESD training is different from the diagnostic endoscopy.